Welcome to the Transforming Healthcare Coaching Podcast, where we bring you guidance and coaching perspectives so that you can level up in your life and work.
All right, everybody. So we're nearing Christmas time. We're nearing the final holidays. And today we'd like to bring light to the season for our healthcare professionals, for those. And we know that many of our audience here are working during these busy times and these fun times. And hopefully we can give some insights and advice for those who are working during those busy holidays, some advice into how to have fun even while you have to work. And for those who do get the time off, hopefully we can help you recharge, reset, and truly be in the moment with those that you love. So today we have Grizelda and Amy with us. Thank you guys for joining us.
Hello.
So before we get started, is there anything you'd like to say?
Just welcome for being here and can't wait to start this conversation.
Great.
Yeah, and during the holidays, whether you celebrate them or not, it's also bringing the year to a close and certainly a time to just reflect and enjoy the holidays.
Love it. So, Grizelda, Amy, what are some ways healthcare professionals who do have to work through the holidays find moments of joy and meaning, even when they're not able to celebrate in the traditional ways with family, friends, and loved ones?
I found when I was working the holidays, I really enjoyed when the busyness of all the people weren't there. They're still busy and you have patients to see, but there's a lot of busyness that seems to just be gone because so many people are out of the office. And I really appreciate that time. It adds kind of a magical element for me. And I always really found myself making more effort to connect with the patients and the people. And I really enjoyed that.
For me, it was more of if I was on a shift, then it was how do I make the best out of the situation? And also for my own family. Like if I was going to be away from home, how would I kind of set things up to either celebrate before, celebrate after? And that way it was still keeping the purpose of me not being here is because I am doing something and setting that intention when I go to work, right? I'm going to be the best that I'm here. The patients definitely don't want to be there. So how can I show up for them?
I love that. It's basically finding ways, if we do have to work, right? How can we have a good time and celebrate with the people that we work with? You spend most of your time at work and oftentimes with the same coworkers. They can be part of your family, right? You can celebrate with them and then your patients as well. A lot of them don't want to be there that day. And many of them are very glad you are there. And how can you celebrate with them at that same time? And I think that's an important thing you had mentioned, Grizelda, as well, is you may not have to dedicate that specific, for instance, Christmas, right, to celebrate Christmas. My family notoriously does it on Christmas Eve. I make it in my schedule to have Christmas Eve off, and then I have to work some of the other holidays. But that way I can still be intentional and celebrate those moments that are important that come around during these holiday seasons. For those that fortunately do get the time off, it can still be challenging though to fully unplug from work. And I struggle with this myself, even though I have Christmas Eve off. I know I have to be up at 7 a.m. to go work my double shift on Christmas. What advice would you give for somebody to be fully present with family and loved ones during the holidays?
I think for me, it's setting the intentions. If I'm working around the holidays, it is going to be more busy. Some people are going to be leaving town so that before the holiday or however that we would get, especially when I was in private practice, and trying to get those notes done and if there were gifts and preparing for people over, that can be pretty overwhelming. So it's not just I'm not working, so I'm going to be relaxed. It's trying to set it up. So if I knew things were going to be happening around, trying to set intentions of if I was going to be responsible for a certain meal or having people over, I may say, okay, we're just going to pick up or how can everybody participate and just kind of not putting it all on me and also just getting things ahead of time and not waiting till the rush of things, right? So it's just a matter of setting the intention of how I want to feel, because I know everybody's going to feel that too.
I also find it helpful to not be stuck to that things have to go a certain day or a certain time. And everyone knows what the schedule is. So the family and friends also adapt and change. And you just know you're doing your celebration at this certain time or this certain day. And so I guess it's not being attached to that it has to work out a certain way. And that in itself just gives you a little bit more ease and freedom. And really just being able to enjoy, as long as you're not on call and you don't have the calls coming in, really just setting the intention, as Grizelda said, to be present and be with your family while you're enjoying the holidays.
I love that. And as I start to get older, I don't know how you guys feel about this, but I'm like, I feel less inclined. And I don't know if this is because I typically work every holiday. And actually, and I'll talk about it, I actually request most holidays on, because oftentimes there's an incentive pay, right? But I also find it as a time that you can actually start to bring joy and cheer to your coworker, which my coworkers that I consider a lot of times my family, that we work to save lives. We are a team, and I enjoy celebrating moments with them. And also because I know that, for instance, I don't have kids, I've got dogs, then I don't have kids, right? And I have coworkers that have young kids, and I know that they would want to be with their family, their young ones, creating special moments. So if I can work during the holidays to alleviate that so that they don't have to worry about coming in, that makes me feel a lot better as a person as well. But it is very hard to unplug from work sometimes. And this is not just even during the holidays, but in particular to the holidays, like you want to make sure that you're really recharging and refreshing and being present, because you may not see family that you have that are coming from Europe, for instance, right? Or from across state that you see maybe once a year. You really want to be there present for them. And I think this kind of goes back to prior episodes where we talk about setting boundaries with work and saying, okay, I'm not going to let work follow me home today. Today it's going to be at the moment, phone away, technology away, and I'm here with my loved ones. And we are talking about everything non-work, unless it's something positive, and focusing on what brings us joy.
I'd like to just add that sometimes with me that I do have my business and it's only me. So it's not really that I can turn it off or shut it off. I mean, or get away from it, but it's more of still setting the intention. That it's like, it's pretty cool that I could be at home and I'm still on and I can clock in and clock out whenever I want. And I just try to remind myself that I'm in a position right now that I get to choose. I could respond right now immediately, or I can respond a little bit later, but it's still trying to be present in the moment and then saying, okay, I need a couple of minutes to send refills or however, right? Because I mean, it's still something that I'm providing a service and I get to choose how to provide that.
Yeah, you get to choose how you respond in the moment and feel that decisions you make are not burdening you and burdening the family. Exactly. We're all at the power of choice, right, Griselda? So the holiday season often brings a lot of pressure. I don't know about you guys, about buying gifts, attending certain events, whether that be going to church or going to a party, keeping up with holiday traditions. What advice would you give for healthcare workers on staying focused on what truly is meaningful to them?
Oh, I love this topic. We do one of those Kris Kringles. We celebrate that holiday, and it's more about this event. I mean, I think it's a $20 gift. It's not about the money, but it becomes this game that we look forward to every year. And there's like 25 of us. And we go through this process of playing the silly game, and then you open your gift, and we have the best time. And it takes like over an hour to do this whole thing. So it's kind of the highlight of our party.
There's a lot of clowns in my family, so we try to hide things. And if it's maybe a gift card inside a roll of toilet paper, so it's kind of a silly thing. But yes, it's the way we come together, and even the kids now want to be participating. And I think it's also coming back to the mindful gifts. That it's the way you're saying, just the experiential. Like for me, it's let me do some simple hand sanitizers, but it's actually something that it's the DIY project. So yes, it saves money. It definitely takes a lot more time, but the feedback I get from the people I give, it's like, wow, this is so awesome, or I love this scent. And it's also just kind of creating the memories with others. So it's not something that you're going to see it and then let it go. It's like usually it's a soap or the candle or the hand sanitizer and those type of things that I think are been great.
What I find is that having experiential gifts is a wonderful way to focus for the holidays. It does keep me focused on our family, on what's most important, which is being together. And we create some kind of a theme, whether it's going to a show together or on a hike together, and then having a potluck or making a nice meal, visiting neighbors. It really has an intentionality around it, like Grizelda talks about. And yet it's keeping us all engaged and active and creating memories together. And I prefer those gifts more than an actual wrapped up expensive gift. So that's kind of how we do it in our family.
I love hearing how other people celebrate their holidays and each other. And thank you guys for your tidbits, even like the DIY projects. I love any kind of do-it-yourself project, from interior designing in my house and things outside my house. But also, I agree that I find it much more meaningful when I get a gift from somebody who made something for me with their own hands. Like my mother, she's an incredible artist. She doesn't draw as much as she used to, but when I get a drawing from her, she pours hours into it. And I showcase that around my house because I love it so much. And it's just a unique twist, right? Or even when a coworker even makes me something that's like, is that a Christmas ornament? I'm like, she made that for me. That was for her own hand. I love that. But Amy, I also love, which I never really thought of, and I'm feeling like I could even adapt to this, is that theme and the intentionality behind going for a walk, a hike, like doing something, I don't know, cutting a Christmas tree, or I don't know, that's probably over by the time you're celebrating, but something that you're doing together that has some intentionality of being together, I find so beautiful. And the other thing that runs through my mind now when I start to think of gifts for other people too is that, say you don't have the time, you're rushing last minute, or Black Friday shopping deals are coming out, right? It's a good time. You're buying for yourself, is that I oftentimes buy people things that I use every day that I love. Whether that be like a certain soap or like a cologne or whatever it may be, something that like you use that you love, that maybe somebody else may love, I also find to be really good gifts because it's speaking to something that you've experienced and that you have. Thank you guys for sharing. So for those who work irregular hours, celebrating in traditional ways can be very difficult. How can shift workers create special moments, even if it's not actually on the actual holiday?
If I'm on a shift or if 'cause sometimes we would try to split up in private practice, or even when I was at the hospital, we would split up as far as who was working what part of the weeks before I started my own company. But try to say if I was going to be there, then let's go ahead and I'm going to order some food as I was the doctor and for the rest of the group, or just kind of setting something fun. One of my colleagues was great as she was the fun team, we would always say, but she would bring in, let's decorate cookies or let's have stocking stuffers. So sometimes I'm not too creative with some of those things, but also relying on others to kind of help with that part.
And it goes back to this theme of one size fits one. It's really, whoever's listening, think about what would be meaningful for you and what would be something that not only that would help make the shift or the time be more meaningful for you, but also who you're going to be working with, and maybe tapping into what about them and how you can create some kind of an environment together that makes the day more meaningful for you.
Got me thinking too is, what's to say that you can't create a tradition at work if you're doing shift work? You may not work every Christmas, but like, how about having Christmas in the emergency room, having 5 to 10 minutes where you guys, like you mentioned, Griselda, like guys order food, or everybody brings in like a potluck and you just give thanks to each other for being there, right? These are little things that we all can do, or like a little secret Santa that a lot of departments do, or something like that, where those who are intending to work that day can all participate. I, I think we can all create special moments, even if we have to work during the holidays, even though, things may seem like a typical busy day. we could still all find moments of clarity and reset and recharge and thanks to each other. As we approach the new year, as we're end of December already, what kinds of intentions or goals would you suggest healthcare professionals consider to cultivate more balance and fulfillment in their lives as we near the new year?
Again, doing your own self assessment. And what I used to like to do was at the end of the year, make a list of what happened during the past year. And I'd go month by month just to help jog my memory. And then, first of all, it was a really cool exercise. I guess I've stopped doing it. I'm talking about it in the past, but I did it for many, many years. And so I would reflect on the year and then see, wow, look at all this stuff that went on in my life. And then while contemplating about it, think about how I want to move forward or how I can maybe had started some things during the year so I can move that forward, or what can I do different to bring more balance into my life. So with that assessment, I found it very helpful, one, to just observe what happened in my life during the last year, which was usually pretty amazing when I thought about it. And then it helped me set up intentions for the following year. And with that, I also looked at how things were managed in my life and made note to self of what I can do to help balance it moving forward.
I was thinking right now, Amy, when you were saying about note to self, I recently discovered how you can send a text later or an email later, that it's like sending maybe next year, sending it in November, right? Kind of lessons learned from this year. How can I show up during that season differently? And I think just for in healthcare, it's just those intentions. And that choice word is kind of my theme right now, but it's how do we want to choose to show up? And then just reminding ourselves that. Like, it's not about the gift. Like, I choose to be present, or I choose to provide those experiences. And more importantly, kind of tying it back to bringing that light, that it has to start with me. And that's the only one that I can control. So it's like making sure, how bright is my light, and how am I reaching out to those that I want to brighten up as well.
Taking care of yourself is taking care of others. And I love it. The reflection is huge. Reflecting on the year, what went well, what didn't went well, what do I want is a big thing. Everybody has these desires. What is it that you want? I think that is a curious thing. And a lot of New Year's goals, everybody's heard it. You've experienced it yourselves. Like, you'll have these New Year goals and you don't stick with it. And in our next episode, we'll give you some tips and advice on how to stick with any New Year goals that you create. But as coaches, we work with clients with individual goals. So this is individualized to you. What you want is individualized to you and personalized to you. So what is it? And just having a general concept about it. Is it better health? Is it more connections with colleagues? Is it a new house? There's so many different things that it can be. And just writing it down and then starting to think about what those next steps will be. And we'll give you, like I said, some tips and advice on how to begin taking those steps in the coming year. How can healthcare professionals turn their holiday shifts into an opportunity to bring light to others, whether through small acts of kindness, gratitude, or joy, especially if they have to work during the season?
Well, people do talk about how that holiday time of the year is also a very difficult time for a lot of people. And there is more depression and accidents and things that can happen. And so I think being very mindful and listening, whether it's your coworkers or the patients coming through, and just really notice where people are at. And we all have our own way that we bring our light and we care and reach out to people. So I guess being mindful of also where other people are at. And like you said, how can we brighten the light of the season, and making an effort to do that?
Yeah. I love what you just said, Amy, about just like looking at who are you with, right? Reading the room, picking up those cues. And sometimes it's just that simple smile or hug. Like, we all are going through things, and we don't know what someone else is carrying or what someone else is dealing with. So just kind of keeping how can I bring kind of my positivity or my energy to the room? Just those little small things.
I think this is a good follow through to what you mentioned earlier, Amy. And it's like, how would you want somebody to treat you if you had to go in during the holiday. And as you mentioned, Grizelda, I want to be smiled at. I want to be hugged. I want to be feeling like we are celebrating the holiday together, even though it may not be ideal. And you're right. We don't know what somebody else is going through. They may have their entire family at home and they're not telling you that. And they're having maybe 50 cousins or whatever all together and they can't be there. And that may be really hard for them. And so to create those moments of joy, and then also for the patients, obviously, there's a lot of times where our judgment gets cast and like, oh, you're here for a cough on Christmas. Can't you wait the next day and try supportive management, right? Like it's so easy to cast that judgment when it's like most of the time they don't want to be there. And you being positive and saying, Merry Christmas. I always make the joke that, and I've worked notoriously the past 6 years every Christmas. And a lot of patients, I find at the beginning of the day, they'll say Merry Christmas, but then it'll start to die off throughout the day. And I always have to remind the patients, like, it's Christmas. You have to say Merry Christmas. And just make it playful and joyful in a way that some of these patients may not have family. I've encountered multiple elderly, for instance, that family's not there for them or they're by themselves now. They don't have any connection. So bringing that moment of light to them can actually bring a lot of light to you. Any parting words, team?
I know we keep talking about the holiday season, but we can practice all year long. I'm kind of setting my own intentions or goals already. I know we'll talk about that next time, but it's also about let me practice when I am going to be giving gifts this coming year. What's most important? I love Amy's advice about the experiential gifts. I'm going to definitely try that and just kind of practicing being mindful and just celebrating, just kind of being there, being part of the teams that we are in.
Thank you all for sharing. Merry Christmas.
Happy holidays.
Holidays.
Thank you so much for listening to the Transforming Healthcare Coaching podcast. If you found this episode interesting or useful, please share it with your friends and colleagues in healthcare. And we would love it if you hit subscribe so that you never miss an episode. We want to help with the topics and problems that you want us to talk about. Leave us a review wherever you listen to us with suggestions, feedback, and praise. It means so much to us, and we actually read every comment. For deeper support in your life and work as a healthcare professional and leader, head over to transforminghealthcarecoaching.com. Download our free 5 reflection questions to jumpstart your journey and join our email list to be the first to know about our coaching programs. We're also excited to offer the MedThrive community, a supportive space for group coaching and self-paced personal growth, providing an alternative path to growth beyond one-on-one coaching programs. Find out more and join this thriving community at transforminghealthcarecoaching.com. Together, we can transform healthcare, one person at a time.